Usually when we talk about a medical diagnosis, there's this expectation of like total precision.
Right. Oh, absolutely.
Yeah, it's kind of like engineering. You break your arm, you get an x-ray, and it shows that jagged white line, and the doctor just points and says, there it is.
Right. It's visible, it's categorized, which is honestly incredibly comforting, broken or not broken.
Exactly. But then you step into the world of women's health, specifically localized hormone therapy, and suddenly it's like that x-ray machine is just totally broken.
Oh, yeah. You're looking at a diagnostic and treatment landscape that is, well, it's incredibly murky.
Right. So today we are asking a very pointed question for this deep dive. Can compounded estriol creams be customized for patients who are sensitive to commercial cream-based preservatives?
It is such an important question. It's because
Yeah.
a lot of people are dealing with this.
Yeah, and we have a really great stack of sources today. Pharmaceutical stability studies, drug monographs, and clinical guides from compounding pharmacies. We're going to synthesize all of that to get to the bottom of this.
I'm excited to get into it. It's a topic that really needs clarity.
For sure. So for anyone listening right now, if you have ever experienced irritation or burning or just discomfort from a standard prescription cream and you thought like, wait, am I allergic to my own medicine? This deep dive is for you.
Yeah, because it is one of the most frustrating experiences a patient can go through.
I can imagine.
You're prescribed a medication to soothe this inflamed sensitive tissue, right?
Mhm.
And then the actual vehicle delivering that medication causes a burning sensation that is like way worse than the original symptom.
It's basically adding insult to injury. But to understand how we actually customize a solution, I feel like we first have to understand the commercial reality we're trying to replace.
Exactly. We need to look at what's currently on the standard pharmacy shelf.
Right. So let's look at standard commercially available options. A classic example that shows up everywhere in our sources is Premarin vaginal cream.
Yeah, Premarin is essentially the legacy standard for an FDA-approved commercial product in this space.
And what actually is it? Because the sources were kind of wild on this.
Well, the active pharmaceutical ingredient is a mixture of conjugated equine estrogens. And equine is really the operational word there.
Yeah, equine as in horses.
Exactly. It's derived exclusively from natural sources. Specifically, it's blended to represent the average composition of material derived from the urine of pregnant mares.
Which is honestly always a fascinating detail when people first learn about it. Like, wait, horse urine?
It's definitely a surprise for a lot of patients. But, the hormone source is really only half the story here.
Right, because the drug monograph for these commercial products lists a whole host of inactive ingredients too. These form the actual base of the cream.
Yeah, and that's where the trouble usually starts for sensitive patients.
Looking at the list, we've got cetyl esters wax, benzyl alcohol, sodium lauryl sulfate, and a very prominent one, propylene glycol monostearate.
Right, and from a commercial manufacturing standpoint, those specific inactive ingredients are brilliant. I mean, they do exactly what they're supposed to do.
Which is what? Exactly. Just keep it stable.
Basically, yeah. A commercial pharmaceutical company has to design a cream that can sit on a boiling hot delivery truck in July,
Oh, right.
then survive in a warehouse, and then sit on a pharmacy shelf for a year without separating, or worse, growing bacteria.
So things like propylene glycol and benzyl alcohol, they act as these heavy-duty stabilizers and preservatives to ensure that mass-produced shelf life.
Exactly. It's all about logistics and scale.
That makes perfect sense for logistics. But, the way I think about this kind of commercial medication is that it's exactly like buying clothes off the rack.
Well, that's a good way to look at it.
Right. It's designed to fit the statistical average. For the vast majority of people, an off-the-rack sweater fits fine. It keeps them warm.
Right.
But if that specific wool blend gives you a terrible itchy rash, it doesn't matter how durable or well-made the sweater is. You simply cannot wear it. You need a tailor.
That is a perfect analogy. Because for a minority of patients, those standard excipients, especially the propylene glycol, they act as severe contact allergens.
And we are talking about an area that is already highly sensitive.
Exactly. When you're dealing with something like genitourinary syndrome of menopause or GSM, the vaginal mucosa is already deeply compromised.
It's thin, it's fragile.
Yes, it's thin, fragile. The pH is altered. So applying a really strong chemical solvent to that specific environment, it just triggers an immune response.
The body basically identifies the preservative as an invader.
Precisely. And then the local immune cells release histamines, which results in, the inflammation, the burning, and the itching that patients complain about,
Okay, let's unpack this. We have an off-the-rack option that is causing an allergic reaction in the exact tissue it is supposed to be healing.
which is a nightmare.
Right. So if we need a tailor, the sources point us straight toward a compounding pharmacy, specifically 503A patient-specific facilities.
Yes, 503A pharmacies are key here.
These are labs that essentially make medication from scratch, right? How does that actually work?
Well, a 503A compounding pharmacy doesn't just pull a pre-made tube off of shelves. They source raw pharmaceutical-grade active ingredients,
Okay.
and then they blend them into a specific chosen base at a precise dose, which is tailored entirely to one individual patient's prescription.
Okay, so if the compounding pharmacy is our tailor, we first need to pick the right fabric.
Following the analogy, yes.
And in the world of vaginal hormone therapy, when we're trying to treat that tissue fragility we just talked about, the primary fabric of choice is estriol.
Yes, estriol, which is commonly referred to as E3.
Right, E through.
And to understand why it's the molecule of choice, we should probably just quickly map out the estrogen landscape in the body.
Yeah, that would be helpful.
So the human body primarily produces three types of estrogen. There's estrone, which is E1, estradiol, which is E2, and estriol, which is E3.
Right, and the compounding guides highlight that estriol is actually the weakest form of estrogen.
It is, yeah.
Like outside of pregnancy, where I think it surges to support the uterus, it's usually completely undetectable in the body.
That's correct. It's a very weak estrogen.
But wait, I'm confused. If estriol is the weakest hormone on the menu, why is it our first choice for building a custom therapy? Doesn't weak just mean ineffective?
See, what's fascinating here is that its biological weakness is actually the exact mechanism that makes it perfect. It's superpower for localized treatment.
Really? How so?
Well, when endocrinologists call a hormone weak, they're talking about receptor affinity. Imagine the estrogen receptors in your cells are locks, and the hormones are the keys.
Okay, checking with you.
Estradiol, E2, is like a master key. It slides into the lock, it turns it, and it stays locked in place for a long time.
Which triggers massive systemic effects, right?
Exactly. But estriol, E3, is a key that slides in, turns the lock to activate the cellular response, but then it immediately falls out.
Oh, interesting.
Yeah, has a very short retention time in the nuclei of the cells.
So it basically does its localized job and then gets out before it can set off alarms everywhere else in the body.
Precisely. And this actually ties into a crucial biological concept called first-pass liver metabolism.
Which is what happens when you take a pill orally, right?
Exactly. When you take a hormone pill orally, it goes to your stomach and then gets shuttled straight to the liver. The liver acts like a bouncer at a club.
I love that. A liver bouncer.
Right. Its entire job is to scrutinize, break down, and alter substances before they're allowed into the general systemic bloodstream.
So the liver is filtering the hormone before your body can even really use it.
Yes, which is why oral pills often require much higher doses just to ensure that some of the hormone actually survives the bouncer.
Right.
But when you apply a weak topical hormone like estriol directly to the vaginal tissue, you completely bypass the digestive tract and the liver.
Oh, wow. So it just absorbs straight into the local mucosa.
Exactly. It binds to those local receptors briefly to restore moisture and tissue integrity, and then it clears out. So you get incredibly high local efficacy with very minimal systemic absorption.
That makes a ton of sense. For a patient who desperately needs local relief for vaginal atrophy, but wants to avoid the systemic risks associated with stronger whole-body estrogen therapies.
Like an increased risk of blood clots or hormone-sensitive breast cancers, yeah.
Right, so for them, estriol is this brilliant biological workaround. It targets the specific tissue that is suffering from estrogen deprivation without flooding the rest of the body.
It is an incredibly elegant, localized solution. Though, in compounding practice, it's actually rarely used entirely on its own.
Really? What do they mix it with?
Compounding pharmacists frequently combine it with a very small amount of estradiol to create a specific ratio. The most common is the biased cream.
Right, the biased. The sources show biased typically uses an 80.20 ratio. So that's 80% estriol and 20% estradiol.
Yes, they work synergistically. The bulk of the formula, the estriol, does the heavy lifting. It restores localized moisture, increases blood flow, and encourages the return of healthy lactobacilli to stabilize the pH.
And then what does the estradiol do?
That small 20% kick of the stronger estradiol provides elasticity and structural plumpness to the tissue itself.
Okay, so we have our active ingredients dialed in. We have the perfect custom fabric, as we were saying. But the core question of this deep dive is about the delivery system.
Right, the base cream.
How do we deliver this estriol-estradiol combination without using the commercial preservatives that cause contact
Well,
dermatitis?
the primary villain the compounding literature targets for removal is propylene glycol.
Let's break down what propylene glycol actually does because it's everywhere. It's categorized as a humectant and a solvent.
Ugh.
Humectants are designed to draw and retain moisture, and solvents dissolve other ingredients to make a smooth, homogeneous cream, right?
Exactly. And on healthy, intact skin, it is generally considered completely safe.
But on compromised mucosa,
It's a different story. A strong solvent strips away what little protective lipid barrier is left. And a humectant, if the environment is already severely dry, can actually pull water out of the deeper tissue layers.
oh wait, so it exacerbates the dryness.
Yes, it pulls moisture away from where it's needed. Add the localized immune response we discussed earlier, and it becomes an absolute nightmare for sensitive patients.
So the compounding pharmacist just completely evicts it from the formula.
You do. They use specialized hypoallergenic bases instead.
The sources list these proprietary bases engineered specifically for this. We're talking about things like Versabase cream, Elige anhydrous vaginal, Phytobase, or HRT heavy.
Right, and these bases are meticulously formulated. They're free of dyes, fragrances, parabens, mineral oil, and petrolatum.
You know, it really reminds me of ordering coffee.
How so?
Well, you still desperately want the caffeine. That's the therapeutic hormone you need to function. But say you're lactose intolerant. You cannot drink standard dairy milk without severe physical distress.
Right.
So you have the barista swap the dairy for oat milk. You get the exact same therapeutic benefit of the caffeine, but it's delivered in a vehicle your unique biology can actually tolerate without an inflammatory response.
That is exactly it. It's all about changing the vehicle while maintaining the active payload. But, in pharmaceutical compounding, there's a catch.
There's always a catch. What is it?
When you remove standard heavy-duty chemical preservatives like propylene glycol or benzyl alcohol, you introduce a massive new problem, which is stability.
Oh, right. Is this customized hypoallergenic oat milk version of the cream just go bad sitting on your bathroom counter after a week?
That is the ultimate challenge. And it's where the rigorous science of modern compounding comes in.
Tell me about it, because I was wondering how they solved that.
The clinical guides point to these extensive stability studies from companies like Mediska. They supply raw compounding ingredients.
Okay.
And they run intense stability indicating testing and antimicrobial effectiveness testing on these hypoallergenic bases.
And the data they produced is, frankly, staggering. The studies show that compounded hormones, including these exact combinations of estriol and estradiol, when they're formulated in bases like Versapro or HRT cream base, they maintain extended beyond use dates.
Yes. They remain stable for up to 180 days at controlled room temperature.
That's wild. 6 months of shelf life for a customized, completely allergen-free medication?
It is impressive. But this raises a major mechanical engineering problem.
The dispensing hardware, right?
Exactly, because you can design the perfect preservative-free cream in a sterile lab, but if you put it in a traditional metal squeeze tube with a messy plunger applicator, the entire system falls apart.
Because the moment a patient opens a standard tube, air rushes in.
Yes, air brings oxygen. Oxygen causes oxidation and degrades the hormones.
And on top of that, traditional open tubes or jars require the patient to physically touch the product or the rim, which introduces bacteria from their hands.
Right, and since you've removed the heavy chemical preservatives, the cream basically has no defense against that bacteria.
So if you remove chemical preservation, you have to replace it with mechanical preservation.
Precisely. That is where the modern dispensing hardware comes in.
The sources highlight that modern compounding pharmacies, they don't just upgrade the cream, they completely upgrade the container itself.
Yeah, they use devices like the Topi CLICK Pearl, specialized airless pumps, and microdose pens.
I found the microdose pens really interesting, the ones utilizing a 1/4 gram actuator, like Epiphany Compounding mentions.
They are fantastic. They rely on airless vacuum technology. Inside the pen, there is this piston mechanism.
Okay, so when you twist or click the actuator, what happens?
The piston pushes exactly 0.25 grams of the cream up and out of a one-way valve.
Oh, and the vacuum pressure ensures no air ever gets sucked back inside.
Exactly. The cream inside the barrel remains entirely isolated from the environment. There's no oxygen, no bacteria from fingers.
Wow.
The physical hardware is what makes the 180-day shelf life of a preservative-free base scientifically possible in the real world.
And beyond just keeping the medication sterile, that hardware fundamentally changes how a patient actually uses the medication. It allows for titration.
Right. Which is just the clinical term for fine-tuning your dose.
Because with a standard commercial tube and a plunger, trying to accurately measure out like a quarter of a gram is nearly impossible. You just squeeze and hope.
Yeah, and when dealing with hormones, even weak, localized hormones, imprecise dosing leads to totally unpredictable results.
So the microdose clickers provide absolute mechanical consistency, which gives the patient total control.
They really do.
So what does this all mean? If your symptoms flare up during a stressful month, or if they completely subside, you can consult with your doctor and simply use one less click or one more click.
Yes.
You adjust the dose dynamically at home based on your exact biological feedback without needing to throw away a messy tube and buy an entirely new prescription.
Which is huge. Let's actually ground all this biology and engineering in the real-world case studies from the clinical compounding blogs we reviewed.
Yeah, I loved these. Let's talk about the hypothetical case of Ariel. She's a 53-year-old woman.
Right. Ariel's experiencing persistent dryness and internal tissue tightness, which is making intimacy incredibly uncomfortable for her.
And she wants local relief, but she absolutely refuses to take oral medications. She doesn't want the systemic side effects or the liver processing we talked about earlier.
Understandably. So her clinician prescribes a compounded estriol estradiol vaginal cream.
And because it is delivered via a microdose specialized dispenser, Ariel just applies it locally.
Exactly. The weak estriol binds to the receptors. She gets localized relief for tissue elasticity, and because it avoids that first-pass liver metabolism, she minimizes systemic exposure.
Then we have Nadia, who is 57, and her situation is the exact scenario that sparked this entire deep dive.
It really is. Nadia was suffering from frequent irritation and a light burning sensation due to estrogen deprivation.
So her doctor prescribed a commercial cream, right?
Yes, but the commercial cream made the burning significantly worse because of the preservatives.
Right. The propylene glycol triggered a massive localized immune response in her fragile tissue.
Exactly. So Nadia's gynecologist pivots to a 503A compounding pharmacy. They create a personalized ultra-low-dose estriol cream in a completely propylene glycol-free base.
And what's the result?
She gets the moisture and tissue support required to combat the atrophy, but she entirely sidesteps the contact dermatitis.
That is amazing. I mean, this level of customization fundamentally shifts the power dynamic in healthcare for you.
It really does.
You are no longer trapped trying to force your unique biology to tolerate an average formulation.
Right. If we connect this to the bigger picture, though, it is vital that we address the regulatory reality of this process.
Good point. Because commercial drugs and compounded medications, they sit in two very different regulatory categories.
They do. Commercial drugs, like our earlier Premarin example, they are FDA-approved products. They go through a centralized mass-market approval process.
Okay, and compounded medication.
Compounded medications are not FDA-approved products. Because they are custom-made for an individual patient, they simply cannot be mass-tested in the same way.
Right, you can't run a clinical trial on a cream made specifically for Nadia.
Exactly. But that absolutely does not mean they are the Wild West.
Right. They are intensely regulated just through a completely different framework.
Yes. 503A compounding pharmacies are strictly regulated by state pharmacy boards, and more importantly, they are mandated to adhere to USP standards.
Okay, we should definitely define what that actually means. USP stands for the United States Pharmacopoeia.
Yes.
It is essentially the definitive scientific rulebook for medicine in the U.S.
That's a great way to describe it. The USP outlines exhaustive, legally enforceable protocols for how medications must be handled.
It dictates the exact clean room environments required, the sterilization protocols, and how to scientifically calculate those beyond use dates we mentioned earlier.
Furthermore, compounding pharmacies are required to utilize FDA-registered pharmaceutical-grade raw ingredients.
So they aren't just buying random powders online.
Oh, no. Definitely not. Every powder, every base, every hormone is tracked with a certificate of analysis to prove its absolute purity and potency.
So while the final custom cream on your bathroom counter isn't stamped as an FDA-approved product, the physical practice of creating it is a highly regulated medical science.
Exactly. It acts as a vital safety net for patients who fall outside the statistical average of commercial manufacturing.
It basically bridges the gap when the mass-produced system just fails.
Right. It catches the people who otherwise would just have to suffer.
Which brings us back to the central mission of our deep dive today. Can compounded estriol creams be customized for patients sensitive to commercial cream-based preservatives?
And the answer, unequivocally backed by the stability data, the receptor biology, and the clinical practice guidelines, is yes.
Yes, absolutely. You do not have to endure allergic reactions or burning from propylene glycol or any other mass-market excipient.
Through bioidentical hormone replacement therapy, a compounding pharmacy can act as your tailor.
Utilizing sophisticated airless hardware and hypoallergenic bases to create a bespoke approach tailored to your exact symptoms.
It removes the trial, error, and honestly, the physical pain from the healing process.
It's incredible. But before we go, there was a fascinating detail hidden in the margins of our sources today that completely reframed how I look at this hormone.
Oh, the facial cream thing.
Yes, we spent this entire deep dive analyzing the vaginal application of estriol, but the clinical guides note that this exact same weak hormone is increasingly being prescribed in compounded facial creams.
It's super interesting because the cellular mechanism of action is identical.
Right.
When estriol is applied locally to the face, it binds to those same localized receptors. It has been shown to boost collagen production, increase skin thickness, and improve hydration.
All while maintaining that crucial benefit of minimal systemic absorption.
Exactly. It doesn't flood the body.
So if you can use customized, localized hormones to safely rejuvenate vaginal tissue, and you can use the exact same biological mechanism to safely rejuvenate facial skin, what other areas of localized tissue degeneration could bespoke hormone therapy revolutionize in the future?
It's a great question.
If we can target the precise tissue that needs healing without ringing the systemic alarm bells in the rest of the body, the possibilities for localized healing are just wide open. Something for you to ponder.
It is a truly remarkable frontier for personalized medicine.
It really is. So the next time you look at a prescription cream, read the inactive ingredients and wonder, am I allergic to my own medicine? Remember, you might just need a better tailor. We will see you on the next deep dive.